Hello, everybody. My name is Rafael Lefkowitz. I'm an occupational medicine physician and researcher at Yale Occupational and Environmental Medicine. I'm very grateful for the invitation to speak here today about the health effects of social isolation at sea, with an emphasis on the most severe outcome, suicide. And while I do that, I'll try to take you through some of my thought process when I think about hazards at sea. So what I really want to talk about is the state of the medical literature on seafarer mental health outcomes, including suicide, and how occupational health research can help reduce these preventable deaths at sea. So we'll really focus on what are psychosocial hazards in the workplace, how we can learn more about these, what the barriers are to getting more information, and I'll suggest ways that Maritime Ministries can help. Some of you in the audience are already helping. I hope that you really walk away from this talk today with understanding why occupational research at sea, and research particularly in this area, could be so important to preventing bad outcomes, how Maritime Ministries can really help achieve this goal. One of the first questions I always get is, what is occupational medicine? So let me explain that a little bit. Occupational medicine is the practice of medicine in workers, treating them as a population with specific health risks, such as work hazards, with the goal to prevent bad health outcomes resulting from those exposures. We aim to prevent injuries and illness in workers. Research into root causes of injuries and illness, research again into the root causes of these injuries and illnesses, can help not just the individuals, but entire workforces, and that's where it becomes a population issue. There are other things that occupational medicine doctors do, like treating workers specifically, or working in policies and government, and we do that as well. So when we think about the workplace, we like to think about it in terms of the hazards, and that's one paradigm. So, for example, in seafaring, a biological hazard may include like cold and flu viruses, or outbreaks on a ship, or sexually transmitted diseases at port. Chemical hazards may include chemical cargoes, lubricants, cleansers, petroleum, and other chemicals. Physical hazards can include everything from heat and weather extremes, vibration, pitching of the ship, to noise, ultraviolet sunlight exposure. But of course, today I want to focus on psychosocial hazards, which we think are equally, if not more so, important in all workforces, and particularly so in seafarers. The challenge with psychosocial hazards is that they're very intangible. They can be much less tangible and difficult to measure compared to some of the other hazards that we were discussing before. You can see by this list, which I put together from the literature, as well as experience working with seafarers on ships, there's a wide range of potential psychosocial stressors. I want to focus a little bit today on the last category there, which is isolation, particularly social isolation. So what are the effects of social isolation, and how might we be able to measure that? So a key study in seafarer isolation was performed by Helen Sampson about 15 years ago in 2002. Demonstrated a lot of reasons that seafarers have experienced isolation at work. And since that publication in 2002, much of the ethnographic and anthropological research has confirmed these very same exposures as being extremely important. Again, a qualitative study. There's very few quantitative studies in the medical literature on seafaring stressors. Here's a good one by Marcus Oldenburg from 2009. There's been very few self-reported surveys, but this is one good example of it. As you can see, there was a high reporting rate for several key stressors in this survey. Most notably, separation from family was reported as being a stressor. Insufficient qualification of subordinates, another stressor, so having to manage people you feel are not up for the job and having no choice in that matter. High demands and time pressure, this is a big one. And of course, long work hours. And I would add to that, if they would have asked, probably shift work, little control over those hours when you get them. So they did a review, same group, of 13 studies of stress and strain in seafarers. They found, again, a significant burden of stress at sea. This might not be surprising to those of you who work very closely with seafarers, but importantly, we find that we need to be able to demonstrate this so that way we can help inform policies. So again, a review of 13 studies showed there was a lot of stress reported at sea, but some very significant limitations to these studies. Probably the most important one in my mind was that a lot of the studies didn't incorporate knowledge about key occupational variables, like, well, where are they working? How long have they been working for? Are they working in the deck area, the engine area? What's their rank? A lot of these factors might impact how much stress they're feeling at work. And again, these were included very small numbers of seafarers in these studies, so it's hard to generalize to the greater population. And also importantly, a lot of the studies were done in populations from European backgrounds, which may not adequately represent global seafaring. So what do we know from the occupational medicine literature? Psychosocial stressors can cause significant health effects. These include anxiety and depression, lost work, lost productivity, substance abuse, and suicide. We'll focus on this last one. So there's actually one really good study from over 20 years ago that demonstrated a high risk of suicide among all workers at sea, but particularly so among deck and engine crew. Again, remember I discussed a little bit before how there's not many studies that actually broke it down by risk according to job area or work site, as we might say. But this was one of them. So in this one, we were able to see that younger seafarers also had higher suicide rates than older seafarers. And the crew members, the lower ranking rating crew members on ships also had higher rates of suicide when compared to the older officer corps. So I'm not sure if this is due to risks. It was probably a combination of work-related risks, as well as what we might call a healthy worker effect, or a happy worker effect, you might say, where people who are unhappy working at sea at a young age might actually leave the workforce and go do something else if they get the chance, leaving happier and more productive workers in the older area. But this is something that needs to be examined more closely. This was a pretty good study of suicide rates in 3 fleets, again, small numbers, British, Singapore, and Hong Kong fleets. The investigators looked at the proportion of deaths due to particular causes, and consistently across the board, they found that suicide represented about 4 to 5% of deaths among seafarers. There's a significant number of deaths as well I'd like to call your attention to due to accidents and illnesses, which is, I think, another area where we need to focus if we're going to be preventing deaths at sea. So what do we need to know in order to compare the risks of suicide in seafarers compared to other occupations? For that, we need something like rates, where we can actually say what is not just what's the proportion of deaths due to suicide in seafarers, but really how frequently are seafarers dying of suicide, and how does this compare to people working in other jobs or in other places in the world? So in an ambitious study from the United Kingdom in the 80s, and start looking at data back from the 80s all the way to 2000, merchant seafarers were second only to veterinarians in one time frame in terms of suicide, at about 68 per 100,000. And then again in another time frame where they looked at it from 2001 to 2005, again, second highest. I'm not sure if you can see that, but they're basically the second to highest bar from the top. And in the later review, compared to coal miners, second only to coal miners in terms of risk of suicide. Again, still very high, 68 per 100,000. And if you compare that to the usual rates of suicide in the adult population, it's more like, it's about 6 times the usual rate. So very hazardous work in terms of risk for suicide. We don't know what the source of that is. We just know that these workers are at great risk, at least when examined in one population in the United Kingdom over 20 years. So when we see rates like that, we got to figure out why are there such high rates of suicide among seafarers. And so when I think about this as an occupational medicine doctor, I try to think about it in terms of a causal pathway. So I've shown a little bit of my hypothesis up here. probably starts with a combination of individual risk factors combined with psychosocial stressors at work. At some point, these develop into a syndrome that might be recognizable as depression or anxiety, some midway point where there's still an opportunity for intervention. And then some of these folks eventually commit suicide. So, diagnosing and treating does not mean medications and psychotherapy, but as a first step, we could probably try to recognize the problem. Study focus groups or survey to understand the burden of this disease. And if we could stop depression and anxiety from progressing to suicide by providing the appropriate support, I think we could eliminate a lot of cases. But even taking it a step farther back, from a preventative medicine perspective and occupational medicine perspective, is to identify the risk factors that lead to the depression and anxiety in the first place, and sort of nip it in the bud. So there's a lot of research gaps, as we've discussed. I'll just summarize them real quickly. Many studies to date have explored some small suicide rates in specific groups, for example, in the UK study, but that might not reflect current crewing practices from other areas of the world. Another major challenge is to understand the risk for mental health disease among seafarers. Again, we don't even know the amounts of seafarers that actually have depression and anxiety that might lead to suicide, so we're really missing a lot if we're just measuring the very end point outcome. But even beyond that, getting a little bit earlier, we need to figure out what are the exposures that might cause those risks. And this includes both individual factors that people bring to the table when they come and join the seafaring community, but also risk factors about being on board these ships. So there's specific stressors on these ships that we can help reduce so that we get less people to the tipping point. But throughout all this research, a major challenge is really access to seafarers. And it's here that I would like to spend a little bit of extra time. So I think medical research can increasingly turn to maritime ministries. What I can tell with my experience so far, our goals seem very well aligned. In addition, maritime ministries now and in the past have really recognized the need for physician involvement with sailors, as is demonstrated and was pioneered by Seamen's Church Institute with radio telemedicine service back in the early parts of the 20th century. And this is another one of my favorite studies that I'd like to show, demonstrating a real collaborative effort. This is a collaboration between the International Maritime Health Association, which is an association of occupational health doctors and seafaring, ISWAN, ITF, and Seafarers Hospital Society, surveyed over 595 women seafarers, which if you think it's hard to survey male seafarers, imagine what this must have been like. Importantly, it really helped shed light on the stresses of seafaring for the women seafarers. And this was published just about 6 months ago, but really represents, I think, where we need to go in our direction with research. Currently, Yale Occupational Environmental Medicine is working together with 2 seafarer ministries to fill some of the research gaps. I'd like to highlight and thank Seamen's Church Institute for that work. I've had a really wonderful time doing that, and I hope we continue to do that down the line in the future, as well as Sailor Society with Sandra Welch, providing funding, research, and access to seafarers. And really remember the key point here is getting access. It's really hard for us land-based doctors to reach out to seafarers. We need your help. So some of the things that we're doing is trying to describe occupational exposures, getting back to the rates of injury and illness, things that might predict bad outcomes like death at sea. We particularly want to note what are the prevalence, what is the rates, how many people are experiencing psychosocial stressors. And of course the main goal is to prevent the most severe adverse health outcomes and anything in the pathway, depression, anxiety, and suicide. So sometimes I think, well, in medicine, we're always asked, to prove that we can demonstrate good outcomes before we get funding. I'm not sure if it's the same in the maritime ministries, but we can help measure outcomes and demonstrate the usefulness and the utility of all the interventions that you do on a daily basis. We can, for example, I can imagine that we can demonstrate how counseling and ship visits can reduce seafarer fatigue, anxiety, and depression. This might be very useful to know. Just a quick example of what some good information on rates can deliver. So the Veterans Health Administration has been working very hard to combat high rates of suicide in veterans. And they've put forth a lot of effort into describing the rates of suicide among their veterans. I'm not here to read this long slide, but the point is that if we could just get at the right numbers, then we can start creating some important interventions, which have just come out. And for example, the VA has started to increase their telehealth access for mental health for their hard-to-reach veterans. I see this as an important parallel to hard-to-reach seafarers if we could get it out there. In fact, Sailor Society is currently moving in the direction and has developed a wellness app in a similar approach that the VA demonstrated. I think we need more studies like these, which demonstrate real risk between work sites on a ship. And I'd just like to conclude with one quote from a study that Roberts put forth in his reviews of seafaring and suicide. And he did the research on the UK group. And since little is known about the mortality and morbidity of most of the world's 1.2 million seafarers who are now employed with flags of convenience registries, we really need to focus the future studies on conducting population-based studies in these fleets. In other words, the research to date has been done in other types of fleets, not representative of the current fleets. And to do this, we need access to the seafarers, and we need your help to do that. So again, just want to close with the keynote message. Really, seafarer medical research can help bridge gaps, and it can also help demonstrate the importance of seafarer ministries and the works that we can do together. There's a lot of opportunities for collaboration, and I'm open to discuss that point at any time. I'll leave my contact information as well, and invite you to reach out to me at any point. Thank you.